Good afternoon. It's a fine afternoon. Welcome to today's episode, a second episode of the series that we had talked about. So, what we are supposed to be looking at today is healthcare regulation in Kenya, how it's done, and Kenya, just like in many other countries, regulates every cadre in healthcare. In other words, there's no time you'll walk into a hospital and just find anyone picked on the street to attend to you for any service. So various cadres are regulated by different regulatory bodies that include the Medical and the Dentist Acts. I'll talk about it in a bit. But first things first. A young lady once walked into a hospital, a public health hospital, and she was expectant. So there's a lady, she's expectant, and one of the things that we do is we encourage each and every person when they're expectant that they attend clinics, and there are certain tests that we do at clinic levels that helps the baby in the womb or in the uterus grow healthy, and also to evaluate on if the mother is safe to have that baby. So one of these tests includes HIV, or generally mothers have their ANC profiles done. An ANC profile includes the HB level for the mother, the hepatitis B surface antigen status, HIV, a urinalysis, and blood group and rhesus. So all these things are run in the lab by qualified personnel. So this lady walking into a hospital was tested for HIV, and as one of the tests, and the test turned positive. By then, it's a while ago. I think maybe 5 or 6 years ago, even more. By then, there was a first test, the HIV determine, and then first response test being done at the counselor level. So apparently both the tests turned positive, so that day the lady was enrolled into HIV care treatment. After, I think she never disclosed this status to anyone because issues with disclosure and stigma for HIV were, were quite strong during those days. Nowadays, stigma has gone down generally, but she never disclosed this status to anyone. So she took her drugs to protect the baby from getting the infection. I think she was a single mother, so she wasn't married at the time, so there was no risk of infecting her partner. And life moved on. 2 years later, being on ARVs, she is retested again, and apparently the test, she went for a retest somewhere else, so the test turned negative. What? Okay. She went for various confirmatory tests that all proved negative. Now the lady sued the government. I'm yet to update myself on this story, on if she got justice, over that, because it's wrong. It was wrong for the government to for this specific hospital. It was a public health hospital to put her on ARVs. First, give her wrong results, and then put her on ARVs for more than 2 years when she was actually not HIV positive. Who do you sue? And these are the reasons why healthcare has to be regulated. These are things that have to do with human life, and they have consequences, serious consequences. HIV drugs are not very easy to take. For the one or two of you or three of you of my viewers who are on ARVs, you can testify to this. They are not very easy to take. So this is a pain that someone was taken through wrongly. Okay, yeah. And today we actually waking up to a certain reality of there were task policy sharing guidelines that were once brought in by the Ministry of Health that targeted taking a number of functions from various departments into other smaller departments. Lab was one of the major departments that were going to be affected by this. So the testing was going to be taken away. Most of the tests were being taken away from lab to either the community or to other cadres. I won't delve so much into that. And today we're even having the Pharmacy and Poisons Board purporting to be regulating blood and blood products, which is not okay. Pharmacy is drugs, personnel, and advising the government. Issues to do with testing, that remains a laboratory issue, because you ask a pharmacist about blood, the principles of blood transfusion, they know nothing about it. You ask them about, some of them don't even know blood groups. So as I said earlier, a hospital is an institution of different cadres in healthcare that are working together towards the well-being of patients. So each and every department usually is regulated by a different regulatory body. Now the Medical Practitioners and Dentists Act oversees the registration and licensing of doctors and dentists. So all the medical doctors and dentists are regulated by this body. It's enshrined in Cap 253 of the Kenyan Constitution. So each and every doctor who is practicing, whether a specialist, whether a medical officer, a general practitioner, is registered by this body. Pharmacy and Poisons Act enrolls and registers pharmacists and pharmaceutical technologists. So you can always access the registers from these various bodies, even the ones that I'm still listing, and verify if whoever is attending to you is enrolled and licensed to do that. Now the clinical officers that we meet most of the time in the level 2, 3, 4 facilities are regulated by the Clinical Officers Council that is enshrined in Cap 260 of the Kenyan Constitution. Nurses, all nurses and midwives, both specialists and general nurses, are licensed by the Nurses and Midwives Act in Cap 257 of the Kenyan Constitution. Now the public health officers are regulated by the Public Health Officers Act Council, and radiographers have to register with the Radiography Protection Board, and also have membership of the Society of Radiographers in Kenya. Now Kenya Nutritionist and Dietitians Institute does it for the nutritionist and the nutritional technologist. Now the Kenya Medical Laboratory Technicians and Technologists Act spells out the regulation, is the one that does the regulation of laboratory products, or apparently should be doing this, but part of it, even some of these devices are being regulated by the Pharmacies and Poisons Board. If you go to some of these public health facilities, you'll find the malaria RDTs are distributed to pharmacies. The stocks are taken in the pharmacies. I've never understood the logic on why this happens like this, because this is a testing issue. You tell a pharmacist to perform QC, the quality control of the test kits. You'd see wonders, but I don't want to delve into that at this moment. So the Medical Laboratory Technicians and Technologists Act in Cap 253A of the Constitution regulates the medical laboratory technologists. Now, all the other cadres have generally remained unregulated and unsupervised. So the government in 2017 came up with with a body called the Kenya Health Professions Oversight Authority, KHPOA, that should be registering all the other cadres that I have not listed above. So the Kenya Health Professions Oversight Authority registered all other cadres except the doctors, the dentists, the pharmacists, the pharmaceutical technologists, the clinical officers, the medical laboratory technologists and technicians, the nurses and midwives, the PHOs, the radiographers, and the dietitians. So all these bodies have registration details of each and every practicing officer, and you can always be able to verify. It's a challenge to each and every person to always be attended to by a qualified and licensed professional. Yeah. So if you want to verify the registration status of different cadres, then you can always just go to the website and confirm. And also some of these cadres, the regulatory bodies have short codes for verification. You can just always send a message with either the name or the registration number of the person, and then you receive an SMS in return on whether the person is registered and licensed or not. So as I said, these healthcare professions are highly regulated in Kenya, right from training. You cannot just walk into any college and purport to do nursing and then come and seek registration with the nursing council. So these bodies regulate even the training. And the challenge to every prospective student, no matter the area of healthcare that you want to study, always ensure that you go into an institution or an education institution that is registered and licensed by these bodies to issue that kind of training. Because you will go for training, for example, in nursing, in a nursing school that is not accredited. There are so many outside here, and they'll siphon your money. You do a training for 3.5 good years, and then you come out and you go to nursing council. They tell you, you know what, that institution is not recognized and is not authorized to do training in medical laboratory, in nursing, in medicine, in pharmacy. Who will be at a loss? It's you. So it's always upon each and every one of us that before you join in any institution of training for any healthcare course, walk into the respective regulatory body and find out if the education institution is licensed to issue that kind of training. Because I know in a number of them, after you are enrolled for training, you are issued with an index number that literally takes you through the duration of training. Even when you're going for the rotations, you're going for internships, you're going for attachment, it is that index number that is usually in play. Okay? Yeah. So each time you find yourself being trained in an institution that is not always accredited, then you will always have yourself to blame. Now, these regulatory bodies are the ones that take care of you in hospitals. And in the case of the lady I talked about, the case needed to be taken up and check out on who did the test. Were they authorized to do the test? Who approved the test? And whoever was enrolling this lady onto ARVs, what were the modalities? You get? Yeah. Yeah, I believe that is sinking in. Don't be a victim of quirkism. Always when you walk into a hospital, try and get attended to by a qualified and licensed professional. Because if something of this sort happens to you, then you have where to run to for justice. We've got people who have been wrongly misdiagnosed, and it's in a wake of what do I call it? A lot of misdiagnosis outside here. A lot of non-diagnosis is outside here. A lot of negligence, medical negligence is outside here. So whenever you are attended to by someone who is not licensed and authorized to do some of these things, you will not always get justice in case something goes wrong. And this is why you will not walk into a hospital and find a laboratory technologist in the consultation room. No. You will not walk into a hospital and find a clinical officer in the laboratory. You will not walk into a hospital and find a security guy doing delivery in the labor ward. So each and every cadre has distinct responsibilities. I have my boundaries as a laboratory technologist, as a nurse, as a pharmaceutical technologist, as a doctor, as a clinician. I have distinct operation areas and boundaries that I do not cross. So whenever you walk into a hospital, sana hizi is a private, these small ones. Nowadays, so many pharmacies outside here are mini hospitals that are not official. It's a pharmacy, but it's a hospital complete with consultation, with lab, with a minor surgery area, performing minor surgeries and certain procedures. Whenever you walk into a facility and you find one officer doing everything from consultation to lab to pharmacy to minor surgeries and all this, question the registration status and the licensing status of that person. Because as I said earlier, all these professions work as a team, and each part of the team, it's just like the hand. You cannot bring a mouth to your hand. You cannot walk using your hands. Yeah, it's your feet that will do the walking. You cannot hear using your mouth, and you cannot see using your ears or your nose. So whenever you walk into a facility and you find the same person doing everything, question, even the licensing status of that specific facility might be in question. That is why we have these regulatory bodies. So do not take one. I want to summarize all these things and say that, one, do not take a student to an institution that is not licensed and registered to offer training in that area of training. Kama ni lab, kama ni pharmacy, kama ni medicine, kama ni clinical medicine, kama ni public health, don't just walk a young, mtaharibu future zenu if you do that kind of thing. Mtaharibu future zenu. The other day a young lady was asking me, she knows where I work. So ilikuwa in the campus, I think sometimes in September, but she didn't go. So I was asking her, anafanya kwa hoteli fulani, utu tukibanda, and I was like, kwani wewe hujaenda shule? Kwani mbona hujaenda shule? And she was like, mimi sijapata pesa. And then ile kitu yenye nimeandikishwa kwenda kufanya, mimi sioni kama nataka kufanya. She had a B- and she had been admitted to one of these leading universities to go and do I think something in agroforestry, but she didn't want to do that. She had really wanted to become a nurse. So she was asking me, where can I be able to do nursing? We went shopping. We even went to KMTC and found out. And the admission requirements for institutions are very strict. You go to the wrong training institution, you're doomed. That money is wasted. There's another student walked into a medical laboratory class. I want to mention the institution in this show today. She has wasted a whole term, and from January next year, she is looking for a different institution that is accredited. These are things that you always need to be sure of on admission. And then after, seek advice from the regulatory body. Get indexed. Go through your training, do your exams, go for your internship, get licensed, and practice. Okay? Yeah, that's usually how things are done. So just as we finish up, as we sum up today, ensure that you're trained and you train well. You're licensed. For those who are prospecting to study anything in healthcare, and for you, the patient, ensure that you're attended to by someone who is properly trained, someone who is registered, someone who is licensed to practice. Because you will get attended to by someone who is not licensed or registered to practice, then story yako haitakuwa mzuri. Some of you like walking into quacks offices. We walk into a hospital and you've already googled your symptoms. Nowadays we like googling. Google is a doctor. Google is not doctor. Itakupoteza because you google the symptoms and signs and symptoms of HIV. You will go to the hospital with that kind of stress, and who knows, utapatikana nayo tu. Utagoogle hapa symptoms za cancer, ujipate hospitali ukijiconvince uko na cancer. Always walk into hospitals with open minds and be attended to by the right people. Know the officer who is attending to you in what department and what scope of things that they can be able to do. This is very good information for you. Otherwise, you take things for granted, and you take things like normally uende usipatane na mtu wa security amekaa pale, and ama lab tech tu kama mimi, because I'm a lab tech, I'm a practicing lab tech. Nipate pale consultation room and so on my last appeal, for those who haven't subscribed to this channel, kindly subscribe, put on a notification button. So that was that. I'm sorry for the short interruption. As I was saying, the only way that you can be able to support this channel is hitting the subscribe button and putting on a notification. Each time I upload a new video, you're able to be notified and see. This is going to be a very informative channel, by the way, and we are going to be having guests here from time to time to enlighten you on some of these things that I'm discussing. So it has been me, your one and only laboratory doctor, Isaac. Until next time, see you guys. Yeah, and get tested by qualified and licensed personnel, not just testing. Get attended to by qualified and licensed personnel in each and every hospital you go to. Okay, don't be attended to by a quack. Quacks will kill you.